Roga, epidemic, that is epidemic and endemic disease. As per the Charakacarya, Aniyata Hetu of Abhishana Nidana is one of the indicative of infectious disease. Davanagere says some of the skin infectious disease like smallpox etc. spread through inhalation of air to the skin. Viadya says when water and land contaminated, it loses all its property and responsible for growth of various germs which helps to spread infectious disease. And the Agantuja Roga, disease of external cause, that is Agantuja are those which caused by the external factors like bhutas, that is microbes, and vishas, that is toxins or poison. Due to the viral infection, we can observe that it will become the toxemia. In that we should accept that visha as toxins from we are taking the food and external cause, and also we should take the toxemia or viremia which are caused by viruses and other microbes. That is kama, that is sexually transmitted disease, etc. And the endogenous microorganisms get immune system. That is contagious disease. Shushruta has clearly mentioned that this is like Kushta, Shota or Upasargika Roga, and Vapata's case says skin and eye disorders are more communicable. Indicates some infectious disease will spread by direct skin contact or use of infected articles of patients, that is Kushta, Abhishanda, some of the sexual intercourse when sexually transmitted disease like Upadamsha, etc. Then Graha Rogas. Graha Rogas are described as a living being with contagious property and having ability to feed on food and meat. Some are pathogenic and some are not pathogenic. When human beings are attacked by the evil demands, attacked person will have evil desires and produces fever, vomiting, loose motion and other infectious symptoms. And in this way, author of ancient Ayurvedic texts have highlighted infectious disease. In the modern perspective, infectious skin disorders. Infectious skin disorders are contagious, transferable, or communicable disease. Compressed clinically evident illness that is characteristic medical signs and symptoms resulting from infection, presence and growth, etc. Next, the infectious pathogens are viruses, bacteria, and fungi, protozoa, and multicellular parasites. These pathogens are the cause of epidemic skin disease in the sense of without the pathogens, there is no infectious epidemic disease. The way of spread of the pathogens to the human being through the blood-sucking insect, coughing and sneezing, and almost all the viral disorders, viruses will spread through the blood-sucking insects. And cause of coughing and sneezing, fecal or oral route, physical contact, person to person, food or water, sexual contact, and vector organisms. How to diagnose the skin disorder? Means the diagnosis of infectious skin disorder sometimes involves identify an infectious agent either directly or indirectly. In practice, infectious skin disorders are diagnosed by their clinical presentation, medical history and physical examination. Next slide. For the laboratory investigations, we should do culture of infectious agent, microscopic features, biochemical tests, and immune assay, molecular diagnosis. Through these medical tools, we can diagnose skin infectious disorders. Ayurvedic line of treatment, as per the Shushruta, in the Samprapti he told, Work in the skin disorders of the doshas, if it is in the throat, Shodhana and Alepa Chikitsa should do, and if the doshas are in Rakta, should do Shodhana, Alepa, Kashayapana, Rakta Mokshanam. If in the Mamsa, Shodhana, Alepa, Kashayapana, Shonitavasechana, that is Rakta Mokshana, Arishta and Mantapana should do. If it is in the Mamsa, means if it is in the Medas, it is Apya. If we do any Chikitsa karma, that is Panchakarma and any Chikitsa, it is very difficult to cure. And Kadira, Tuvaraka, Ballataka, Shilanjatu, and Shuddha Bukulu, etc. are the drug of choice, according to Shuddha. And we can come to the Panchakarma aspect of the skin. In our practice, I am giving through Snehapana, Panchatikta Gugula Vrata without Ballataka. I will give some suggestions here with one story. In my hospital, means when I am studying in the final phase, one junior doctor, he is doing Panchakarma, he did Panchakarma PG. He gave Panchatikta Gugula Vrata to the acne vulgaris patient. She got a rashes all over the body because of Ballataka. The complication of Ballataka, everyone knows that, the rashes and everything. She got all over the body rashes. She wants to cure her acne, but she got rashes. Because before giving the Snehapana or any yoga, you should care about the ingredients and Desha, Kala, Vaya, Prakriti, everything. And also in the Kashaya, while giving the Kashaya and Vati, Sachurna, everything, we should not that much of concentration, it is okay. But we can advise in the Snehana, we should concentrate. Because in the arthritis also, we can observe in the Desha, Kala, we are not seeing means people observe it. And Ama, other Lakshana. So, you should, while writing the prescription, you should thorough with the knowledge about the yoga and ingredients, everything. And for the Vamanopaga, I gave Musta, Nimba, Twag, Patola, Estimadipata, or Panta, individually or mixed with these according to the patient condition. And also milk. For the Vamana Yoga, Madana Phala, Madana Pipali, Vacha, Estimadu, and Saindava. Churna, with these churna, we mix it with honey, and for the as a Vamana Yoga, we are advising. Next slide. If you want to advise Virechana, I give Snehapana with Mahatiktaka Vrata or Trayamana Vrata. For the Virechana Yoga, Trivra Plesha. For the Snehapana, I gave Aroda Karma, that is 30, 60 and 90 ml as per the acne of the patient. And also for the Virechana Yoga, Trivra Plesha, as per the Ashtanga Hridaya, 30 to 50 grams. Along with, I advise Triphala Kashaya, 50 to 100 ml. And then Triurut, Draksha, Triphala Trayam Kashaya. Next slide. Rakta Mokshana. In the Rakta Mokshana, I am practicing Siravada and Jalapacharana. Siravada having the property autoimmune enhancing and which resistance to fight against infectious skin disorder. And the Jalurka, the mouth of the Jalurka having Heparin. Heparin having the property anticoagulant, anti-inflammatory and wound healing. Next slide. Shamanaushadhi in my practice, that is Balagrichari Kashaya, it is my Anubhuta Yoga. If it is in viral disorders, I give 10 to 15 ml. According to severity, 45 minutes or 1 hour liver. Otherwise, according to condition, PID before food. And the Kasisa is for external use. And the Panchatikta Ugulakrita without Balataka, 10 to 15 ml with milk or Kashayam. And PID or BID. And And here, if you mix a bunch of any krudasa, any sneha with the kashaya, it will improve the snehana, means it will give highest effect to the skin. Means as we desire the snehana to the body, no? That much of